Today we're going to start the appendicular skeleton. So with the appendicular skeleton, remember the total system had 206 bones. With the appendicular skeleton, we're actually going to have 126 of those 206 bones. So looking into it, one of the first things we're going to go over is going to be the pectoral girdles. They're going to have 2 clavicles and 2 scapulas, so you end up with 4 bones total. So we're going to look at the clavicle, and then the scapula is going to be found towards the posterior part of the body. Then coming on down, we're going to look at the upper limbs. With the upper limbs, it's going to contain 60 of those bones. You're going to have 2 humerus, 1 on each side. You're going to have a radius and an ulna. And so you're going to find the radius towards the thumb, the ulna towards the little finger or the pinky. You're going to have your carpal bones, so it's going to be 8 on each side. You're going to have your metacarpals, which will be 5 on each side. And then you're going to have your phalanges, which are going to be a total of 14 on each side. So when you think about it, 28 of those 60 bones in the upper limb are going to be your phalanges. So it's not going to be extremely hard for you to memorize these, because you'll have things such as your proximal, middle, and distal phalange. And so that takes up 14 on each side. Then coming on down, you'll have the pelvic girdle and hip bones. And so that's going to be on each side there. And so you have 2 of those, but each one is going to be made up of 3 bones. And then we'll talk about the different parts and processes there. Moving on to the pectoral girdle, here you're going to have your clavicle, which is going to be your collarbone here. And the 3 parts that you need to know, the clavicle is going to be the body part, which makes up the main section of the clavicle. Then you're going to have what's referred to as the sternal end, and you're going to have what's referred to as the acromial end. Now with the sternal end, it could also be called the medial end of the clavicle. And with the acromial end, that could also be called the lateral part of the clavicle. And so when you look at that, if you look at it from above, it's going to kind of have almost a slight S shape to it. Also looking here, you're going to have the scapula. And so this is looking at it from the anterior view. So you're seeing it, how it's attached or coming towards the rib cage or thoracic cavity. And so the part that you see there is going to be more flat and indented. When you look at it from the posterior part or from the back side, then it's going to show you things that are going to be more prominent, like that scapular spine. Also looking here, you can see you have your upper arm bone, which is the humerus, and you're going to have your 2 lower arm bones, the forearm, which is going to be the radius and the ulna. So looking at the scapula here, this is going to be the section that's pointing in towards the thoracic cavity or towards the front part of the body. And some things that you will need to know for this bone for your test are going to be the acromion process. You're going to have the coracoid process, and that actually comes from the word crag, which is going to mean crow, like crow beak. And so that's where that's going to come from. And so it resembles a crow beak. And coming on down, you have what's referred to as this lateral angle here. And then this whole indention section here is referred to as the glenoid process. So you need to know, or the glenoid cavity, sorry. You need to know the glenoid cavity. Okay, and so then you have also your superior border. You have the superior angle. You have the medial border, the inferior angle. You have the lateral border. And then you're going to have what's referred to as the subscapular fossa. And so that's kind of an indentation throughout this area here. Okay, so make sure that you know those specific places. Now, when we're talking about medial border, just remember this means towards the middle of the body. So it's actually going towards like the spinal column. When we talk about the lateral border, this is coming out towards the side of the body, so towards the arm. And this glenoid cavity right here is going to articulate with that humerus or with the arm. And so the main part or the main job of the pectoral girdle is to help the body articulate with its upper limbs. This is looking at the scapula from the back part of the body or the posterior part of the body, or you could refer to it as the dorsal part. And so what we have here, the main part that's going to tell you that this is pointing towards the back is going to be this spine here. And so know the spine of the scapula. You have that acromion process coming out again. You can kind of see a little bit of the coracoid process coming out, but it's not very visible from the back region. You see that superior border again. You got your superior angle. You got your medial border. Remember, that's going towards the vertebrae or towards the spinal column. You've got the inferior angle. You've got the lateral border that's going towards the arm. And then you have what's referred to as the neck section through here. And this whole indented cavity here is going to be referred to as the glenoid cavity, Glenoid, the glenoid cavity. Know that. That's going to be the part that's going to articulate with the humerus. This is looking at it from a view that would be from the lateral side, so you're looking in, and this is going to be where that humerus is going to articulate with that scapula to help bring these bones together. So it helps connect the axial skeleton with that appendicular skeleton of the upper body. And so you see the supraglenoid tubercle, which is going to be towards the top. You have that coracoid process again. Remember, it resembles a crow's beak. You're going to have the acromion process, and of course it has that spine there that it's attached to. And you can see that lateral border and inferior angle from this side view. Now, looking at it again as it articulates or comes together with the axial skeleton and the appendicular, you can see how that clavicle is going to have a articulation here with the manubrium of the sternum. Remember, that's called the sternal end or medial end because it's towards the middle of the body. You're going to see how it articulates with that acromion process here. So that's called the acromial end or the lateral end. It could be either one, so make sure that you can identify both. And then the whole main section of that clavicle is going to be the body of the clavicle. Then, of course, we have that acromion process. We have the coracoid process. And then you see that whole glenoid cavity where it's articulating with the head of the humerus here. Now moving into the humerus. With the humerus, you are going to have the head of the humerus here. Now remember, the head of the humerus is going to articulate with that glenoid cavity, so it comes in together with the cavity. All right, so looking at these bones, A is looking at it from a posterior view. B is looking at it from an anterior view, so that would be towards the front of the arm. And how you know this is by looking at these bottom sections here. Notice how you see the trochlea, which is going to be through right here. You also have that coronoid fossa, which is an indention right there. A coronoid process is going to fit into it. That's part of the ulna. And so that fossa is where the coronoid process can fit in and come together. You also have the medial epicondyle here, and you'll have a lateral epicondyle that you can see on the edge here. And then this circular piece here is called the capitulum. So looking at that, you know that is going to be your front view of this bone. You also have a deltoid process. With that, that's going to be where that deltoid muscle on your upper part of your arm, where you usually get vaccinations and flu shots, things like that, it's going to come in and it's going to attach right there at that deltoid tuberosity. So that's why that is a raised section there. The more that you use that muscle, the more pull there is on that muscle, the more prominent that deltoid tuberosity will be. Another way to tell is by looking at it. You've got your tubercles here. So you have what's referred to as the lesser tubercle and you have the greater tubercle. In between that, you have what's referred to as an intertubercle groove. So know that between the tubercles there. You also have what's referred to as the anatomical neck, which comes around between the head and then the whole diaphysis or body part of that. And then you have what's referred to as the surgical neck, which goes around. So that goes around the main bone. The anatomical neck goes around that section. Of course, the head is going to be that lighter section that you see towards the top. You can also see the greater tubercle from the back of the bone, but notice there is no intertubercle groove or lesser tubercle. Coming on down with remember this is the back side, you're going to have a larger fossa or indention there, and that's where the part of the ulna comes together. It's going to be referred to as the olecranon process. It's going to fit together there with the olecranon fossa. And then, of course, you see your capitulum section, and you see your trochlear section. Now going to the forearm bones. Remember how we talked about how the parts of the ulna would articulate with that humerus? Well, that olecranon process, and if you turn the ulna sideways also, that kind of looks like a U there, but when it's actually correct, it makes a C. So if you turn it sideways, it makes a U, that's your ulna. That's just an easy little way to look at it. So we have that olecranon process here that came together with the olecranon fossa. You have the cornoid process here that came together with the cornoid fossa. You have what's referred to as a radial notch here. That's where the radius is going to come together with it in this section here. And so that's what that looks like. Next, we have some little bumps coming out. You have let's finish up with the ulna. So we have the main body section or diaphysis of the ulna. You have the head of the ulna, which is actually going to be at the bottom of this bone. And then the styloid process, which is going to be that pointy projection that's coming off the head of the ulna. Now coming on over to the radius. The radius is going to be easy to identify because it has a circular head, and circle is radius. The ulna, easy to identify, remember, because we have this whole section here. We have a radial tuberosity. That's just a bony projection coming off of the radius. You have the body of the radius, which is that diaphysis. You have the head of the radius, which is that circular section. And then the radius also has a styloid process, which is that pointy projection coming off the bottom of the radius. Next, we're going into the hands. Notice with the hands that you see the 8 carpal bones. So with these 8 carpal bones, they are going to be found throughout here. Lots of times you hear about carpal tunnel syndrome. That's going to be an inflammation between the carpals and the ligaments that attach those carpals together. So with the carpals, one easy way to help remember these bones in order, you always start with the scaphoid, which is going to be the first upper bone, and then you're going to work your way across. And so if you look over on this side, you're starting here, work your way across. And so think of it as Sally left the party. That's your top row. So you have your scaphoid, which is here, your lunate, which is there, and then coming on over, you have what's referred to as the triquetrium, and then on top of that is a very small bone called the pisiform. And so that's Sally left the party. And then to the bottom, you're going to have the 4, which is going to be trapezium, trapezoid. Then you're going to have the capitate, and then the hamate. And so that would be to take Kathy home. And so that might be an easy way to help you remember these. Now we're going to go into the palm of the hand. You're going to have these coming through here, which are going to be your metacarpals. So metacarpal 1 is with the thumb here. And the thumb is also referred to as the pollux, P-O-L-L-U-X. All right, so coming through with it, you're going to have your metacarpal 1. Then you have metacarpal 2 with your pointer finger. Then metacarpal 3, metacarpal 4, and then metacarpal 5 with your little finger or your pinky. Now with that one, what lines up with the thumb is going to be the radius. So think of it as RT. So you have your radius here and your thumb, RT. That's how you can determine what arm bone it is. And if you're looking at a skeleton, that tells you right away, if you know what your radius is, that is going to be the thumb. If you look over to this side, you have the ulna, and then you can call your little finger over here the pinky, and so that would be PU. So that's another easy way to help you remember those. Okay, going into the phalanges, remember you're going to have 14 total phalanges. With the thumb, you have the proximal and you have the distal phalange or phalanx. That's another one that you can call them. Then when you come on over, you have the proximal, you'll have the middle, and then you'll have the distal phalange or phalanx. And so that's going to be 28 of the bones that you need to know for the upper appendage, 14 on each side. And so when we pick back up next time, we're going to pick up with the pelvic girdle. So that's going to end us for this section.